Good morning and welcome to Viewpoint, your program of personalities, politicians, and perspectives. And also, if you get here early, you can sit here and sit down in the discussion between the difference between the Norwegians and the Swedes.
Sorry you missed that.
That was a very learned discussion in depth, the difference between the Swede and the Norwegian. All right. Viewpoint appearing each Wednesday morning at 08:15 to 0900 hours, bringing you guests from the community. And we're going to hurry right along. Oh, first and foremost, kudos. Sometimes the old fellow forgets a lot, not just a little. Special kudo, and I don't want to make light of this. Thanks to the Military Order of the Purple Heart, I want to remind you that they're going to have a special recognition for Vietnam vets, Vietnamese veterans, and that's going to be Tuesday, March the 29th at 6 p.m. at the American Legion Post. Folks, I'd urge you to come out and take part in that. Sit back and, those of us who are our generation came home into accolades and so forth. And the Vietnam boys, not so much so. And I have great respect for them. Their in-country services were a heck of a lot tougher than my in-country services in the European theater of operations. So,
my brother Jim was in Vietnam.
Yeah.
And it made a real impression on those young people. Gosh, oofta.
Well, that was a different war, of course.
Mm-hmm.
Ours was a so-called popular war. We were attacked. The politicians, I think, arranged this Vietnamese situation. It's a terrible time. Anyway, Tuesday, March the 29th. I'd like to urge you to go out to the American Legion at 6 p.m. Our friend Joe Shaler, Military Order of the Purple Heart, very instrumental in getting some of these things done. So, a kudo to Joe and all the rest of the folks involved in that. Now,
Yes.
Mrs. Busby, we have a very nice young man who's once again given us of his time and talent, and they're considerable. Let's bring the young man on the air.
I'd be right proud to do that. Don Cavi is the Logan County Department of Public Health. And he's had a busy time, haven't you?
Oh, yeah.
Yeah. I bet you hope you never hear the word pandemic again. Yeah, that was tough for everybody.
It was tough, and fortunately things are slowing down somewhat, but we're going to continue to monitor and make sure that everything is still safe, and any signs of increases in COVID, we're gonna we'll be ready, and we have the vaccine, and we have what it takes to help.
I don't really know what the 3rd Street health clinic does except give us shots, which is, and by the way, that's a seamless operation. You're going to get your flu shot or whatever else, and they give you a nice smile. They're very nice, always very nice in there, exceptionally so.
Thank you.
And you don't cool around, cool your heels. You take you right in, stick you, and you're out of there. But the Logan County Health Department has a multitude of things that they do for us. So let's just enumerate some of those, Mr. Cavi.
Oh, sure. You're right, because a lot of people, when you talk to them, they think, oh, they're the place we get our shots at, or they come out, they inspect our restaurants. But we do so much more. Our clinic, we do, like you said, offer the vaccine. We have the back to school immunizations. We have a foreign travel clinic. If people are traveling to another country, we have a list of what vaccines are required. We arrange for them to get vaccinated. We also do lead testing, TB testing. Right now we're doing COVID testing by appointment if people want to call us. We've got so our clinic does a lot of different things. We also monitor diseases in the community. If some certain diseases are considered reportable by the CDC, and if a doctor's office has a patient that is confirmed to have that, they have to report that to us, and we investigate it, and we work with the Illinois Department of Public Health, who in turn works with the Centers for Disease Control. So we do a lot there. We're out and doing our environmental health, we're doing the food inspections, and we're licensing, issuing permits, or we call them certificates for food establishments to operate annually. We go and we do our routine inspections. If there's any issues or problems with those food establishments, we'll work with them to follow up to make sure they're doing it right. With summer coming on, we'll be doing a lot of temporary food permits at some of the fairs and festivals that are going on around the county. We work with the issuing permits for water wells to the contractors. We go out, we do the inspections, we test the wells. Same with septic systems out in the county that are not regulated by the EPA. If you have a septic tank in a leach field and you're not served by community or public sewer, we will issue those permits. We'll review the applications, make sure they're compliant, issue the permits to the contractor. When they're ready to install that, we come out, we take a look at the septic system before they backfill it to make sure that it meets compliance. We do all sorts of maternal child health programs. We've got our WIC program who works with nutrition and with these young moms, making sure their kids are off to the right start. Right now, one thing I'd like to also talk about, and it was brought to me by our WIC coordinator Dana Altmans, is we have it's a breast milk bank. That if anybody wants to donate breast milk, we keep it on hand, but then it gets picked up and it gets shipped out to other communities that their NICU or their neonatal ICU units where they need breast milk. So we are a bank for that. So if people are interested in donating breast milk, they can get a hold of either Sarah Noto or Dana Altmans at the health department and to find out more information about that. We are a lead agency for 12 other health departments, 13 if you count us. For the HealthWorks program, which is it's called HealthWorks program. It's the state of Illinois. It's a program for children in foster care that we case manage and make sure that children that are wards of the state are getting the proper medical care that they need. And right now, within our 13 county area that we oversee, we've got over 2,000 children in foster care. So we are working with other health departments with that. In addition, we do emergency preparedness. We've been working through the whole COVID pandemic, and we've been setting up our clinics. We're constantly doing other preparedness work because there are other events that could happen in the community that we have to be prepared for, that we have to work with other emergency responders with. So we have that. Plus, we have SIU in our doors, and so if people need primary care services or if they need dental services, they can come right in and they have access to that as well. So kind of like a one-stop shop for primary care, dental, and preventative care needs for people. And as far as the health department, I know SIU, we all take major insurance. People just bring their insurance card in and we got it covered for them. So there's quite a bit of things that we do in public health. There's 10 essential services that we do. I don't know if I wish me luck if I try to name them off the top of my head, all of them, but we do disease surveillance, we do education, we do policy development, we do disease surveillance, we enforce ordinances. That's just to name a few of the things that we do. So public health it's really a broad. The definition is very broad, and we're a public health department, but public health really, if it's going to work, we really need the assistance of the entire community, because public health is not only the health department. Public health is the schools. Public health's the police and fire departments. It's the hospitals. It's the nursing homes. We're all part of the public health system. The health department's just at the core of it. So, public health is very broad.
Kind of makes
you don't get very bored, do you?
No, there's a lot going on.
Kind of makes you ask, Judy, what have you done for us recently?
Yeah.
Really?
Yeah.
I'm sitting here thinking, God, Glover, Your predecessor, the Logan County Health Department, your
Lenny?
predecessor was Irma Potter,
Oh, yes.
Logan County nurse at that time. Now, this goes back to the 40s and early 50s. And the Elks Lodge sponsored what they called, God forbid I use this word on the microphone, crippled children. God forbid you could say that word now.
Yeah.
But anyway, that was the name, Elk Crippled Children Trust. And they saw youngsters once a month. And an orthopedic man came from Peoria, Dr. Hugh Cooper's his name, I remember that. And anyway, Mrs. Potter was always in attendance at that. And I happened to be chairman of that trust representing the Elks. And she'd call me on such and such a day and say, Johnny needs such and such. She always asking for permission to buy a prosthesis of some sort. And I'd say, Mrs. Potter, you know, if you think they need it, you just go ahead and get it. We'll take care of the bill. But don't call me for permission. You just use your judgment and do it. She was a godsend and a wonderful lady. And I think back, she really and truly, the truth was kind of the forerunner of our Logan County Health Department. She did all of what you talked about and more, all on her own.
Yeah.
Now, Don, you have a really faithful staff out there, and I don't want to get too poetic about this, but you walk in that front door and you're met with a smile, and you're met with somebody who wants to help you, and they're not just doing their job. You feel like they're interested in you. So somehow you've been able to inculcate that in your employees as they meet your public. So I think, folks, if you go through those doors, thank them. They're doing a whale of a job for us. It's another bureaucracy. And you think in the state of Illinois, that's all we need is another bureaucracy. Well, there's one that gets right down into the trenches as opposed to some ethereal.
Yeah, we appreciate the support from the community, and our staff appreciates that. And that's our job. We're there to help people, and so that's true. And so we, that's why when people come in, they meet a smiling face, and it's because of the community that we're here, and the community. We've been here 50 years now. Last year was our 50-year anniversary.
Oh.
Yeah. So
does that start with Mrs. Potter then, or
actually the referendum I think officially was passed? I can give you a rough time. I think it was November of 71 or 70.
Oh.
It was maybe 1970, but give or take, we've been around 50 years now. So the community realizes our importance, and we play a huge role not only with the community but with our partners, as they're they are important to us as we are important to them as well. So we work.
By the way, they had the sharpest needles in the county. Mary Anderson was your expert in giving shots, and she was always a joy. And you never knew you had a shot when you walked out the door.
Yeah, and she did retire, as you know, back in the end of November. So she put in over 32 years at the health department. So
was she there that long?
Yeah, she was there.
How many employees do you have, Don?
We have 21.
Boy, I'll tell you, that's not a very big crew to handle all you handle.
No, we had, when I took over in the fall of 2014, we had roughly 34 employees. However, as you recall, our home health agency over time, which that was a huge stable in the community, due to competition and other various reasons, we could no longer keep that service, so we lost some employees through that. And then with the dental services, my predecessor, Mark Hilliard, who I give credit for bringing a dental clinic, which really has been remarkable for the community, because the dental clinic sees, I'm going to guess, roughly 5,000 or 6,000 people in the community. That was a huge need in this community. And the only problem with the dental clinic is it's not cheap to operate. And at the time, the reimbursement rates we were getting from the state were very low. They've since increased those rates, but a little too late. But that's why 4 years ago or 5 or 6 years ago, I was talking with SIU, and we made arrangements, and they actually manage the dental operations now. So, and they rent the space from me. But at least we're able to continue with dental services in the community. So that's uninterrupted, and there's still plenty of resources to provide home health in the community as well. So.
We ought to take a couple of seconds, or we won't have them anymore, to recognize our sponsors. Go right ahead, Mr. Rash. And having paid proper obeisance to our sponsors, well deserved, by the way, we bring you back into the studios here at WLCN. Our guest this morning on Viewpoint, Mr. Don Cavi, Major Domo of building out there on 3rd Street that not many people understand what it is. Logan County Health Department doing a whale of a job for each and every resident of the county. What's your daily caseload, Mr. Cavi, out there? I'm sure that changes every day.
It does. It really does. We see it's more seasonal. Usually in the summertime, things start to become more busier because we get a lot of families that are coming getting their children their school vaccines.
Oh, sure.
And of course fall is always real busy because we give a lot of flu shots, so we have a lot of people coming in the fall. So probably our slower times are usually, I would say, January through March or April, somewhere in there. But like I said, we have our times where we are busier than others. Absolutely.
Of course, this year you were practicing pandemic.
Yes.
In the slow time.
Well, it's amazing because you go back 2 months from now, back in January, we were really hit hard. I mean, this Omicron variant really hit. We had not only the community but our staff, and we had to cut back some of our services for a while because we didn't have enough people to work it. And we were running clinics almost weekly, and it was just crazy. It's interesting because I've got some numbers. The state has divided itself into COVID response regions, and Logan County is part of Region 3, which really encompasses Logan County and counties west out towards Adams County and Quincy, and you go down to Morgan County and everywhere in between there. Excuse me. But back in January of this year, the COVID positive testing rate for the 7-day rolling for the regional average was at 21%. In Logan County, we were testing 13.2% of the people were testing positive. As of last week, those numbers are down. The regional average is now at 2%, and our county is at 1.8%. So the COVID numbers are down. So we're really pleased about that. Let's hope they can stay down. Who knows what's going to happen come winter time if this thing rears its ugly head again. We'll have to see how we approach it, but we're going to keep monitoring, and let's hope that things don't get as bad as they have been in the past. Our vaccination rate right now is at 53% of the citizens in Logan County are currently fully vaccinated, meaning they've had their initial vaccine and their booster shots.
How do we compare with neighboring counties on percentage?
Counties with similar demographics, we're kind of in the same area. The counties that are testing, that have high rates of immunizations, are a lot of the collar counties around Chicago. We're seeing have high rates. If you look at Logan County overall, statewide, we're kind of in the middle in terms of rates that are vaccinated. The highest percentage of population in Logan County that are vaccinated are 65 plus ages. Our seniors, we're at 87% of our seniors that are vaccinated, and that really kind of puts us at the upper 1/3, the lower half of portion of the upper 1/3 of the state there. So we're doing real well with our older adult populations. There's just some reluctance on the pediatric populations. Right now, the ages 5 to 11, we're only about 13%, and 12 to 17, ages, we're only about 36%, which again puts us kind of in the middle statewide. So we could do better, but we could be doing worse too as well. But we advertise it, and we're only doing so much. We're trying our best. We're no longer having mass vaccination clinics because the mad rush for that is no longer. However, I do want the community to know if they want to get their COVID vaccines or boosters, we are offering those at the health department for walk-ins. And on Tuesdays, we are offering the Pfizer vaccine. If they want to come in, they can get the Pfizer vaccine. On Wednesdays, we are offering the Johnson & Johnson vaccines. And then on Thursdays, we are offering the Moderna vaccine. So if people want to come in,
Now, it's important for a person who walks in to know that their initial vaccine was, say, a Pfizer. Because if I understand correctly, putting in a Johnson & Johnson on top of a Pfizer is not the most important thing you want to do. Am I correct in that?
Well, if you get the technically you can with the booster shots, you can
Mix and match?
Yeah, you can do that with the booster shots. The only thing right now they're not recommending J&J be used for boosters. They just there's still some efficacy questions on that. So right now the big push with CDC is Moderna and Pfizer for the booster shots. But you can interchange to some degree and use different vaccines for when you're looking at the booster shots. So, but yeah.
Have you ever heard of the dissension before with vaccines? Because even within a family, you'll have divisions of people. These say, by George, not me. And the other half of the family says, well, I'm going to get mine.
Oh, absolutely. Absolutely. And and there's really not much we can do as a health department other than just tell people, urge them to get vaccinated. And if somebody refuses, that's their right. I get it. But be mindful, especially if the virus is spreading in the area, to practice social distancing, wear masks, if you haven't been vaccinated. Right now, fortunately, the numbers are low enough and we don't have the mask mandates anymore, which is good. It's nice to see things get back to normal. I do want people to understand, though, that as a healthcare facility, and I know CDC and the state of Illinois is requiring that in healthcare facilities people do wear masks. So anybody that does enter the health department, we are asking please to understand that and just wear your mask while you're in our clinic, while you're in our lobby. So that's what we're asking of the public right now.
That's a rule, though, right now, isn't it?
Yeah, it's a mandate that the state is actually requiring that in healthcare facilities that people need to wear masks.
Well, it's funny to me when people rise up on their hind legs opposed to some mandate because, like, even speed limits, I mean, they have these rules and you're supposed to follow them.
Right, yeah, and just people have their, and I understand people have their feelings, they feel certain ways about things, but in our case at the health department, it is our policy that, so we're just asking people kindly, if we're going to serve you, please follow our policy. And I know the same with the SIU, being their healthcare facility as well, and they have the same requirement that their clients also need to wear masks. So what can you do? I think there's a lot of common courtesy that's involved, especially if you're out at the during the height of the pandemic. Not worried about it as much now, but when COVID was spreading, common sense, some people are going to refuse to wear a mask, but at least social distance, and just be aware that other people are conscious about it, so but it is good to see things getting back to normal again.
Oh, really?
And let's
I'm
just
sure.
hope. Yeah, absolutely. And I tell you, when I go into a store and I don't have to wear a mask, it feels nice. It's I'm like everyone else in the public.
648-5510. Our guest this morning is not Dr. Fauci. This guy's going to talk to you straight. He's not going to give you a bunch of politician stuff that Fauci was good for. By the way, I read an interesting book done by Robert Kennedy Jr. Quite an interesting. It says "The Real Fauci" was the title of it. kind of a long read, but it was a good read.
Really?
Yes, it was
real-
quite interesting. Right? If you have, God knows where you're going to get the time with the time
Yeah.
commitments you have on your clock. So Don Cavi with this. Listen, this is one county government agency that you're going to get the best bang for your buck. Judith and I both have a very deep feeling of appreciation for Mr. Cavi and his associates out there at
Yes,
the
yes.
3rd Street Clinic. So if you have any questions, 648-5510. Dr. Fauci will be glad to answer them.
Well, I think both Bill and I have a little knowledge, although things have changed greatly.
A smattering.
Since he was a board member or I was a board member. A few years have gone by.
Yeah.
But
yeah.
it's really a respectable organization and a hard-working bunch of people dedicated.
Yeah. Well, appreciate you serving on the board, and right now we have an 8-member board, which back in the past I'm sure it was the same, but we have just a wonderful board of health. Dr. Biven is our medical advisor, and I couldn't be thankful to him enough for the time that he puts in to serve the community. We have a new board member, Dr. Sapra, who we were required to have 2 medical doctors, and he's with SIU, but he's kind enough to come up from Springfield to sit on our board. And the remainder, the other members of our board, I just can't say enough. Roger Box, our current president, and he's been super supportive. Bill Sass, who's been on our board for a long time. They've all been served as past presidents. Mike Rohr, Jason Coble, Dr. Hepler has been serving as the county liaison to our board. Dr. Walker, who's a local dentist, Dr. Todd Walker, has been a longtime board member. So I'm trying to remember. I hope I didn't forget anybody. Did I name 8 people here?
That's the trouble with
Well,
lists,
oh
isn't
boy.
it?
Yeah.
Their psyches will forget that if you did.
Yeah.
648-5510. Mr. Cavi, did I hear you say, I hope I was listening, that generally speaking, as you go about your daily activities, in and out of stores and so forth, that you don't think that masks are necessary? Is that, but perhaps, I don't have to come up with the right word, appropriate, as opposed to, what would your comments about that be?
Now, the state isn't requiring mask use, so it's really, if anybody wants to wear a mask, they're more than welcome to wear a mask. If they haven't been vaccinated, especially, then that's. But my opinion though is if a store or a business is asking people to wear masks, despite the fact there's no mask mandate, just be respectful and mindful that it's their business, and if they want to serve their customers, then they have a right to say this is our policy, and just respect that. I think most businesses now have lifted their policies, which is great, but I think we just have to use common sense to be respectful of other
Yes.
people, and that's kind of how I
think
view that.
the operative word there is respect.
Absolutely.
And of all the things in the world that you can make a stand on, a mask seems kind of petty. I mean, I wouldn't go to the wall with somebody over whether you have a mask or not. That seems kind of a waste of time.
Right. Yeah, it's a very touchy subject, and I hope we don't have to go through a mask mandate again.
Amen.
We've kind of backed off the reins over the last several months of it's a losing battle. Originally when this pandemic hit, since we license food establishments, especially if they refuse to wear masks, we would go in and we would say, you need to wear your mask, and we're the ones giving you the food permit to operate, and we're asking you to wear your mask. But over time, it's at the point now where people just have to. It's really the public has got to be accountable, and they've got to use some common sense, and we understand that. So,
Mr. Cavi, we have a question. So use your headset, sir, so you can hear the questioner.
Thank you.
Okay, go right ahead, questioner.
Not a question, just a comment.
Okay.
Just on the mask issue, just to be aware, not everybody wearing masks is simply because of COVID. Some of us had to wear masks before. Some of us will have to wear masks after. If you have some kind of immune compromised something going on, those masks are really important for some of the people. So I know sometimes we get some funny looks when we're out there wearing masks and the rest aren't wearing masks, but they're there for a purpose. So just my comment for today.
Yeah,
Thank you.
We appreciate that comment.
I appreciate you bringing that up, and absolutely, and you know, one if I could take one positive thing out of COVID, though, I think that people, when they see people wearing masks, and I understand pre-COVID, people probably got looks for wearing masks. Why are you wearing a mask? Hopefully people are going to be more accepting of masks after we've been through this ordeal for the last couple of years. But I appreciate the comment that the caller made. That's absolutely, yeah, absolutely. People do, you know, have other conditions that they may have to wear a mask. And so thanks for the call. I really appreciate that.
Well, wearing the mask equals to the word respect. Maybe you don't have to worry about yourself, but you need to respect your fellow person.
Yeah.
Whether it's a man or a lady or wherever. And going in and about your life, if you're not comfortable wearing a mask, maybe stay at home.
I think one of the biggest problems in our country is the lack of just exactly that. Respect. It's all about me. Number one.
Yeah. Well, and people, the problem with what I've learned, and we all, and I may be preaching to the choir, but people assume things. They see something and then they generalize and they base an opinion and they come to some kind of conclusion about that person, not fully knowing what that person is actually going through in life.
Right.
And I think, you know, if people have an open mind and maybe say, you know, maybe there is a reason why this person is doing what they're doing, and we stop judging people, then, you know, I think that would be a huge benefit.
Besides that, who died and made you queen that you get to call the shots?
You know,
Absolutely.
Going on the premise, Mr. Cavi, that there are no dumb questions, because the questionnaire may not necessarily be dumb, but uninformed. And that's probably the better way to express that. Do you get some really different questions by telephone or by walk-ins out there? Testing the patience of your very patient clerks.
In public health, you get an array of questions, and you hit it on the spot. We get all sorts of questions, and you know, some people think, you know, you're a public health department, you're a one-stop shop, and you know, how come you're not doing something about this or this or this? And we have our limitations because, you know, there's so many ordinances that we have the authority to enforce. Mm-hmm. For example, I'm just giving an example, and we have to try to explain to the public that, you know, here's why. I think, you know, on our website, I give a real good reason, if you go to our complaints area, why some complaints, like nuisance complaints, we can address, and some nuisance complaints we can't. And it's not because we don't want to do it, it's because it's a jurisdictional issue. You know, if a nuisance occurs in an incorporated village and, you know, somebody's leaving their garbage out and they call the health department, they think, well, the health department, that's your area, you fix it. Well, if the city has their own ordinance and that's their jurisdiction, then they have to address that. Whereas if somebody's out in the county, because we're a county health department, our county ordinance will address anything outside of incorporated areas. So if anybody has a garbage issue there, we have absolutely no problem taking care of that. So, you know, we get all sorts of questions. Now, I have in jurisdictions that are not, you know, within our boundary, like if there's a city complaint and somebody has a real issue, and the city maybe is not cooperating, or you know, we will offer to send a letter, you know, or help that person, you know, even though we wouldn't have any teeth in the matter. So we try to help as much as we can, but we get all sorts of questions. You know, people won't, you know, if the electricity's out in their house, how are you guys going to come over and fix it? Or my sump pump's not working, can you fix it? And well, I'm sorry, but we're not a licensed plumber. Yeah. But you know, you just need to call a plumber or something of that nature. But we get all sorts of interesting questions. Absolutely.
They make you be a doctor, lawyer, merchant, and Indian chief, don't they?
Oh, yeah. But you know what? I've always, and I try to stress this with our staff, if you don't have an answer to a question, at least try to find somebody who can answer that, so that person has a bridge where they can get
They're
the
not
information
left out there
they need.
hanging.
Absolutely, absolutely.
Say, speaking of such matters and left out there hanging, I happen to, Gene and I live at the Christian Village, and they made vaccinations available for us. It was just seamless. Was that organized through your health department? Were you a part of helping get that organized?
We did a lot of them throughout the community.
In various nursing homes?
We may have, and I don't, off the top of my head, I'm trying to keep all these
Well,
organized
it's
in
not
my
that
head.
important, but
we've
it's
done
a part of your, under your umbrella. Places such as nursing, the one we live in, and other nursing homes in the community, they go through the health department.
Yeah, we've worked with all the various homes in the community, and we have arranged and worked with them in their efforts to get the vaccine. So we've played a big role in terms of partnering with all, with the nursing homes and everyone else. We've really worked hard with them. I know early on the pandemic, when they prioritized age groups and who got the vaccines, I know we worked closely with some of those agencies. But I do know pharmacies were working and giving a lot of the vaccine out, especially to the elderly in the nursing homes. I think we had some jurisdictional boundaries, but we all worked together on it.
It's been eons since I've had a baby, obviously. But boy, when you have a new baby, it seems like you're forever having an appointment for the next round of shots and so forth. Now, I'm sure you have clinics for people who have new babies too, haven't
We've
you?
got all sorts of, absolutely, we do. So, absolutely.
You're
we
not
do- we
just
do that.
established for COVID,
Yeah,
are
we
you?
pretty much cover the whole
Waterfront.
spectrum. We have a broad spectrum of services, and that is one area, Judy, that we do cover. I was going to point out too, and I know because a lot of people want to get their pneumonia vaccines, and we'll have a press release coming out here real shortly. But there's a new one out that we are going to stock at the health department. The FDA just approved, called Prevnar 20, which is it covers 20 serotypes, so it's more of a broad spectrum type of vaccine for pneumonia related infections. So we're going to be carrying that. So we'll have a press release out on that real shortly. So I wanted to make sure that the public knew about that. If I got a minute too, I just want to recognize the community too, because we had, I believe her name was Kathy Moore. Someone in the community had organized with several dozens of families to raise funds, and they put something together for all the health department staff. We all got a gift certificate package worth, it was either a couple
Oh,
hundred,
nice.
few $100s of different gift certificates to local community businesses. And I can't tell you how thankful that, and I speak on behalf of my staff, we are to all the people involved in that whole effort, because it really showed, they showed their appreciation to us, and we were really thankful.
Well, that's a
appropriate.
bright spot in the world.
Yeah, it
That's
really is. It
appropriate.
really is.
Somebody did something about, rather than have an idea flash between the left and right ear, they connected it and did something about that idea. And so, therefore, people were able to express their appreciation to you by means of that vehicle. That's really neat.
Absolutely, absolutely.
I've never heard of anything like that before.
Yeah, it was amazing. And we had other people. We had local businesses early and during the pandemic. Food establishments would bring food in for us. There were several of them. And again, just amazing how the community reached out to us, especially during the height of the pandemic. And people, when masks were scarce early on, people made masks for us, or they brought masks in, and just another example. And it was just amazing that people would reach out to us like that. So you're right, it is a real bright spot in the community, and there are a lot of wonderful people out there, and we just want to express our appreciation to them.
Oh, bless
So,
your heart for bringing all that up, because we always hear
I
of the
was not
bad
aware of
stuff. That travels quickly.
Yeah.
But the things like this that are just good at
Absolutely.
their core, we
Absolutely.
kind of overlook, don't we?
We sure do. We sure do. So I think-
648-5510. You've got about 4.5 minutes to whip those questions and or comments into Don Cavi, our guest, the major domo out there at our 3rd Street Logan County Health Department. Do a tremendous amount of good, most of which we have no awareness of at all. They just get their job done and move on. Don, you had some other notes, and I want to give you time here.
I was just going to let everyone know our annual report came out. a few weeks ago, and it's on our website. So if anybody wants to go to our website, it's www.lcdph.org, and on our homepage, our annual report is right there. So if people want to read our financials and summaries of all the programs we offer and the amount of services we provided, that's a great resource if they want to look at that. We're hoping to get a newsletter out here real soon. We stopped doing that the last couple of years because of COVID, but we're hoping to get our newsletters going again. So we are working with that. The other thing I just wanted to mention was last week was Groundwater Awareness Week, and so we just want to remind the public that if you're on you have your own water well that you drink from, it's always a good idea to get the well tested for bacteria. People can go to the health department and purchase a kit where they can collect their water, and they can send it to the lab in Springfield. They'll test it. We'll get the results, let them know how their water is. If there is a problem with the well, we'll discuss that with them. We'll let them know how they can disinfect their well. So that's something, and especially too, if people have abandoned wells that are no longer in use, they're really supposed to have those sealed because they can provide an avenue for contaminants to get down into the groundwater. So if anybody has an abandoned well on their property, they need to get a hold of a well contractor, either get it sealed or they can seal it on their own, but they have to get a permit from the health department. So I would urge them to reach out to us. Another thing I want to mention too, if people go to our website, it's a great resource for all of our services. But there is a section under the potable water program where I do want to point out, and I've brought this up in the past, but we sit in an aquifer right where we're sitting now, the Muhammad Aquifer.
Yes.
And they've had some arsenic issues in the water over the years. And so we've been telling people, if you drink the water, if you live in, especially, and I've been told it's more severe west of Interstate 55, but I don't know for sure. But we're telling people, if you get your water from the Muhammad Aquifer and you drink that water, just get it tested for arsenic. And I've got a whole section on our water well section on our website with a map that the Illinois Water Survey provided for me of Logan County, showing where the aquifer is. And there's information on labs that people can contact to have their water tested for arsenic. This has been going on for a while, and we've had press releases on it, and we've had it on our website. So I'm going to take the opportunity now. And as I'm talking to you, I realize we are on the Muhammad Aquifer where we sit right now. So at least according to the map.
All the conversations we've had here this morning, that in and alone of itself may be the most important thing as a takeaway, because there are tons of wells in this community.
Absolutely. So I would urge anybody, especially if especially in this area here in Atlanta and west of Atlanta, that are on that aquifer, we've notified early on when we first learned about it. We notified residents throughout this whole area, and when we got results back, then we would look at another mile radius and we would send letters to those residents, and that was a while back. But I think it's a good idea to let the public know that, just if you're on that aquifer, not a bad idea to get tested for arsenic.
Do you have a question?
Well, no, but Jim always has bottled water here, and I didn't even stop to think about that being the case. Isn't that right, Jim?
I'll drink the water here.
So there's no arsenic in my coffee, right?
Our guest this morning, much appreciated guest, Mr. Don Cavi, the fellow who has the reins and hitches up the team every morning and unhitches them, takes them to the barn at night, pats them on the derriere and says, "Oh no, I better be careful about that." So thank you for your service, Don. We thank you very much for your service. Logan County is lucky to have the health department that we have, and they're lucky to have you as a major domo. Thank you
very much. Appreciate being here. Thank you.